Good morning and a warm welcome to all of you at the 14th Annual Pharma Leaders Summit and Pharma Leaders Power Brand Awards 2021. My name is Leslie Tripathy. I'm an actress, I am a journalist, I am also a social media influencer. I host a talk show called Leslie Show, and I will be the host of this magnificent, iconic Pharma Leaders Summit and Power Brand Awards 2021 by Network 7 Media Group. Let's give a big round of applause to Satya Brahmaji, the founder of this amazing event. For the past many years, we have been celebrating all the game changers of the pharma world. And I'm also honored to say I come from the same state, Odisha, that Mr. Brahma belongs from. So it's a huge honor. You are seeing Odisha representing Pharma land in Mumbai and celebrating all the game changers in Mumbai. When the winds of change blow, some people build walls, others build windmills. This Chinese proverb reminds us that crisis presents choices. Those choices, in turn, shape organizations' future growth paths. Even in the midst of the COVID-19 pandemic, pharma leaders observed closely how the medical community are making remarkable progress, demonstrating unparalleled leadership, drive, and path-breaking initiatives. Pharma Leaders is bold, independent, aggressive, and known to break rules, which are redundant. We believe in empowering, motivating, and infusing confidence in your leadership by honoring you. Pharma Leaders has been at the forefront of highlighting the neglected and crucial issues confronted by the healthcare industry and bring them at the notice of the authorities. Widely perceived by the industry leaders as the voice and reflection of the Indian healthcare industry, Pharma Leaders is present in print, digital, electronic, and live seminars. Which reminds me, ask my brother to go live for me on Facebook. I hope you all post pictures on Facebook and tag Pharma Leaders. And I'm Leslie Tripathi, 26 on Instagram. The COVID-19 pandemic has rapidly changed the healthcare industry, and public health has now become a very prominent stream. As the Indian healthcare industry is booming and is expected to touch over USD 280 million by 2022, there will be evident scope of improvement in health services in the country. India is the leading destination for high-end diagnostic services that need immediate attention of health policies, hence generating lakhs of career opportunities in public health for skilled professionals is forecasted. The pandemic is perhaps the best time for us Indians to answer a key question that has so far remained on the sidelines of our polity. Is healthcare a commodity that can be bought and sold, or is it a right bestowed upon us by the Constitution? While the Constitution doesn't explicitly recognize it as a fundamental right, our judiciary and a large majority of people see healthcare as a right and doctors as performing the hallowed duty of saving lives. But 70% of patient care in our country today is handled by private hospitals that have profit as their main motive. Result is that healthcare is trapped in a strange contradiction. We call health a right, but allow private hospitals to sell that right as a commodity, akin to a pair of bathroom slippers. The only difference is that you can buy a new pair of slippers if the old ones break, but you can't buy your health afresh every few months. Ladies and gentlemen, over the next 3 hours, we will be debating some of the compelling and critical issues, tremendous significance to be deliberated by our esteemed speakers. Before we start our maiden welcome address, we present to you the theme of the 14th Annual Pharma Leaders Summit and Pharma Leaders Power Brand Awards 2021. Can we have the AV, please? And the fact that I'm holding the mic.
We are transforming the entire medical education and healthcare sector. The National Medical Commission will bring great transparency. It will also rationalize norms to set up new medical colleges. It will also improve the quality, availability of human resources in this sector. The government of India will give more than 2,000 crore rupees. We have announced the PM Atmanirbhar Swasth Bharat Yojana with an outlay of more than 64,000 crore rupees in the budget.
Folks, our work begins with getting COVID under control. We cannot repair the economy, restore our vitality, or relish life's most precious moments, hugging our grandchildren, our children, our birthdays, weddings, graduations, all the moments that matter most to us until we get it under control.
It's hard to believe that only a year ago, COVID-19 was still completely unknown to us. In the past 12 months, our world has been turned upside down. The impacts of the pandemic go far beyond the disease itself, with far-reaching consequences for societies and economies. But none of this should come as a surprise. Over the years, there have been many reports, reviews, and recommendations all saying the same thing. The world is not prepared for a pandemic.
You have to provide healthcare and education at a low cost, and you have to create the infrastructure for it. My main complaint with the BJP government here is they simply don't spend enough money on health and education.
These are not getting to them actually. Many times it is surprising. Many private hospitals decline the patients to treat. Government is saying that there should be a public-private partnership and we need to bring out everybody's consensus. All the stakeholders should be in one platform and debate, discuss, introspect and implement. The public institutions mechanism in the country, I am saying with a full sense of responsibility, has collapsed. No PSC, none of the doctors willing to go to the remote areas and none of them even take interest in going over there. Had there been a change in mindset of the government to think something about the doctors, those who pass out? I mean, India has got close to around 10 lakhs registered doctors. Neither the Congress, nor the BJP, nor any other government have failed. There is also a trust deficit between the federal structure of the country. The central government thinks in one line, the state government thinks in another line. In other words, if central government thinks that this has to be done, there will be another Mamta, there will be another YSR, there will be another Kejriwal, there will be another people opposing it. Why the opposite? The opposite for the sake of opposing it. This is where India is going to come. This is where India is going to go global. This is where India is going to transform.
A big hello and welcome to the 14th Annual Pharma Leaders Summit and Pharma Leaders Power Brand Awards 2021. Brought to you by Network 7 Media Group. The theme of 2021 Pharma Leaders Summit is Healthcare Agenda 2021, Awareness, Access and Affordability. Pharma Leaders is an independent media house that voices the opinions of the key stakeholders of the country in an independent and unbiased way. We are unafraid and unmoved when it comes to truthful reporting, as we feel we have a responsibility to tell the world the story as it is. We are independent. We are bold and restless. We are not to please or displease the authorities, but to present facts based on our strong research and ground reporting. When the world celebrated the dawn of a new decade with a blaze of firework parties and revelry on January 1st, few could have imagined what 2020 had in store. The novel coronavirus has paralyzed economies, devastated communities, and confined nearly 4 billion people to their homes. It has been a year and a half that changed the world like no other for at least a generation, possibly since World War II. Legacies of COVID-19 will shape how we work, spend, travel, and more for years to come. The World Bank warns that the pandemic is spawning a new generation of poverty and debt turmoil, and the IMF says developing nations risk getting set back by a decade. While there is no way to tell exactly what the economic damage from the global COVID-19 coronavirus pandemic will be, there is widespread agreement among economists that it will have severe negative impacts on the global economy. Even as we discuss at Pharma Leaders Meet, India saw an addition of a massive 16 million jobs in July 2021. This is about thrice the population of Singapore. Worst, the COVID-19 pandemic has left thousands of Indians unemployed, perhaps forever. The International Monetary Fund (IMF) slashed India's GDP growth forecast from 12.5% to 9.5% for the year 2021-22. We are living in incredibly uncertain times. Pharma Leaders, India's most analytical healthcare news broadcasting media, has been exposing the loopholes of India's healthcare unpreparedness and failure to devise a comprehensive healthcare reforms. Satya Brahma, editor-in-chief of Pharma Leaders Group, pens down his thoughts as he says, "The true magnitude of India's current COVID wave and the human toll may never be known or officially acknowledged. India's testing capacity remains limited, especially in small towns and rural areas, where the virus is spreading rapidly. According to official figures, India has recorded just over 250,000 COVID deaths since the pandemic began, still behind the US and Brazil. Ladies and gentlemen, Prime Minister Narendra Modi, India's most powerful and popular Prime Minister, in decades propelled to power in 2014 by promises to bring Achhe Din or good days to aspirational Indians, now appears a diminished figure, presiding over what many see as the biggest disaster to befall the country since its independence from British colonial rule in 1947. His pledges to increase job-generating economic growth, deliver administrative efficiency, or minimum government, maximum governance as he called it, and boost India's stature on the global stage remain unfulfilled. Tough questions are being asked of Modi's pandemic management, including public health messages that suggested the virus threat had passed. The failure to heed repeated expert warnings of an imminent second wave, and a botched procurement strategy that has led to an acute shortage of vaccines. This is the first time in 7 years that we are seeing a sense of public anger against Modi. It is coming from the urban middle class, which is his most loyal base. These are people who shape opinion. However, Modi's popularity is still at elevated levels that would make most other global leaders green with envy. Pharma Leaders is of the opinion that the health policies are good on paper and very well intentioned, but get thwarted in practice due to limitations in the system's ability to deliver. Satya Brahma says that as we usher in a new era of COVID-19, there is a stronger realization among nations across the world, and particularly India, that it is necessary to introduce measures to bring in increased investments and resources into healthcare, enhance access, quality of health services, address foundational issues, and improve emergency preparedness. India should have done a more thoughtfully planned lockdown and mitigated the humanitarian crisis among migrant workers. And nearly everyone wishes that India will learn from COVID-19, invest more in health, and build a universal and comprehensive healthcare system. Instead of a disproportionate focus on curative care, India must prioritize health promotion as well as prevention and early detection of diseases. This requires a significant increase in the levels of government spending on public health as well as building a well-trained and motivated public health cadre in states across India. The government relied heavily on the public health system for COVID-19, but found the system under-resourced and overwhelmed. Ladies and gentlemen, the public health system in most states in India, with some exceptions, has largely remained sidelined in political discourse over the years. The evidence of this neglect is visible in the form of limitations in basic structural and functional capacities, drugs, human resource vacancies, equipment, demotivated and overburdened staff in public health systems. So even before COVID-19, the public health system in most states in India struggled to cater to the massive health needs of a growing population. Pharma leaders believe that we have to invest more in our public health system. We have to build back a stronger health system with better capacity and interconnectedness. Our health system has to have legitimacy in society, for people's trust cannot be built overnight in the middle of a pandemic. We have to work towards a fairer health system that has explicit intentions to work towards a more inclusive and equitable society. India spends only 1.28% of its GDP on health. There is one government doctor for every 1,445 Indians compared to the WHO's norm of one doctor for 1,000 people. The private system is subsidized and supported instead, which has resulted in rising healthcare costs. Every year, around 7% Indians are pushed below the poverty line due to medical expenses. Why does the public health system of a growing economy like India not have the delivery capacity to vaccinate people at the quick pace that we desire? Pharma leaders believe that the following significant issues will be key to India's healthcare reforms. How can we re-imaging health infrastructure development over the next 5 years for India and Bharat? How can we grow the base at the bottom of the pyramid to build equity in healthcare? What are the ways to decentralize to address key gaps in Bharat, the hinterland? What are the key game changers to bridge the demand-supply gap in skilling? Can we scale up vocational skills training of allied health workers? How can we bring in much-needed reform in the senior care space to improve the quality of life? What do key stakeholders recommend based on evidences at hand? What India can learn from COVID-19 to build a healthier nation? India could have done more to support over 50 million people who live in extreme poverty. Government may not remember any oxygen shortage deaths, but the public certainly does. Poor communication and lack of transparency by the government created tremendous confusion, panic, stigma and distress. Increase the investment in health and strengthen the public health system. The private healthcare sector needs to move beyond profit maximization and towards accepting public health goals and social accountability. Ladies and gentlemen, despite the hype and propaganda, the various schemes that offer free corporate healthcare only degrade the government health sector while doing no real good to the poor. If our leaders invested the same funds towards strengthening government hospitals, the poor and the needy will automatically be served better. But corporate healthcare to the poor appears to be a more powerful slogan than better care in government hospitals. Pharma Leaders is of the opinion that if the government really wants to improve the healthcare standards of the nation, it must first set aside its populist strategist and endeavor to empower the medical fraternity in matters of healthcare matters instead of demoralizing them. The government should make the National Medical Commission a powerful and autonomous body in healthcare policy making and administration and introduce an Indian medical service along the lines of the IAS and IPS for medical professionals so that they are appointed as members of the council and assist the government.
Hello everybody, I'm back. Right now, we will be celebrating the man himself, Mr. Satya Brahma, Chairman and Editor-in-Chief of Network 7 Media Group. Mr. Satya Brahma is India's most respected and distinguished journalist and chairman and editor-in-chief of Network 7 Media Group, known for championing the cause of citizens' rights and free speech. Satyaji has been at the forefront of United Nations peace programs. Mr. Satya Brahma is also the author of Vision India, Truth versus Hope. Truth versus Hype. My mistake. Again, I will repeat the name of his book, Vision India, Truth versus Hype. Satyaji is an industry expert and one of India's top journalists. Satya Brahmaji holds a master's degree in political science with first gold medalist from Berhampur University, Odisha, again we're talking about Odisha, and master's degree in journalism and mass communication. Ladies and gentlemen, please welcome Mr. Satya Brahma to deliver the welcome address. And wait, before he comes to the stage, we will be running an AV of Satya Brahmaji's perspective on the present state of healthcare affairs in the industry and in the country. Can we have the AV, please?
Often reforms walk in the garb of necessity but conceal its plutocratic objective. Reforms without structural rethink creates the problem of access and equity for the majority, particularly the poor. Though in the short term the plutocrats will gain, there is a limit to their growth without the structural reform. Not only the social conflict will divide the society, new resistance will come up and the growth will reach the dead end to their dismay because the consumers with discretionary income will not be available to demand the products they produce. It is time to red flag our healthcare preparedness. Meet Satya Brahma, the visionary chairman of Network 7 Media Group, who's connecting the dots as he says, "I understand that we don't have a magic wand or a fiction Superman to fix the healthcare chaos and challenges, but at least we have the resources to build the healthcare infrastructure." So where are we now? Zero. Satya says that there are two main reasons for poor healthcare coverage. First, we don't have enough trained medical personnel. The World Health Organization recommends a ratio of 1:1000. That is, we should have one doctor for every 1000 persons. For India, the doctor population ratio statistic is unclear and murky. We do not know whether we have one doctor for 1700, 1500 or 1000 persons. We lack clarity because we do not know how many doctors are registered medical practitioners, how many practitioners are still active, how many are out of practice, and how many are quacks. This is one of the major reasons for poor healthcare in India. We don't have enough trained medical personnel. The government admits that more than 75% of the primary healthcare system is managed by people who are not qualified to practice medicine. The Medical Council of India is deeply compromised. India never planned its healthcare system properly. Politicians have no domain expertise. Doctors, nurses, and medical professionals are cut out of policy making. Satya believes that only bold action, not policy tweaks, will bring victory over COVID. India has the capability and the opportunity to become the vaccine superpower of the world, but India's healthcare system is in shambles. COVID-19 is notoriously hard to control, and political leaders are only part of the calculus when it comes to pandemic management. I believe that the situation in the country is worst and man-made. The images coming from India over the past few months are gut-wrenching, and I do not just mean metaphorically. Trails of pyres for as far as the eye can see, scores of people dying outside hospitals, family members desperately searching for oxygen cylinders for their loved ones. India looked like a war zone where people lost their lives to the enemy. Things would have been different had the enemy's potential not been underestimated. It is time to admit our mistakes and accept the reality. In democracies, governments are expected to take responsibility when actions go wrong. We are not ruled by dictatorship, but democracy. Let's not forget we can defeat the virus by lighting diyas and beat thalis from balconies and clap for 9 minutes. We need sustained campaigns and rectifying our past mistakes. The need of the hour is to build the capacities of the existing healthcare workforce, equipping them with the skills and knowledge to provide quality healthcare at the local level. I believe that despite the chaos, devastating impact of COVID-19 pandemic in our lives, I need to share the success stories of how you have struggled to make an impact. Every crisis leads to an alternative system, and that alternative system is nothing but a significant healthcare innovations. Your innovation stories need to be shared to the world. Pharma Leaders is always passionate about your entrepreneurial journey, even when the whole world is clueless what the future will look like. Join me as I share your innovative success stories at the 14th Annual Power Brand Awards 2021.